Hey guys, welcome back to my channel, The ENT Resident. Today I'll be talking about the two signs that we see in CSF Rhinorrhea, and these are the halo sign and the teapot sign. We'll talk about what kind of a sign is this and what do you exactly see in it and what is the reason it is called so. You can also now purchase my notes. I have added links in the description. Okay, so let's get started with our first sign, which is the halo sign. Now, halo sign is this clinical bedside sign that we usually see in cases of suspected CSF leak. Now, what happens here? In a case of CSF rhinorrhea patient, if you drop the nasal discharge onto a filter paper, this discharge, if it is a mixture of CSF and blood, the way it will get absorbed onto the filter paper is it will separate into this central dark red blood spot and a peripheral outer clear ring of CSF. So why is this happening exactly? Here, the mixture basically contains CSF as well as blood. Now, CSF has a lower viscosity compared to blood. Therefore, it is able to diffuse out further more as compared to blood, whereas blood ends up settling into the central area. And this leads to this particular appearance that you're seeing here, which looks like a halo. You can also see kind of a double ring over here. So that is why it is also known as a double ring sign. And the third name to this is a target sign. As you can see, this kind of looks as a target as well. So this is the reason behind the halo sign that we see in cases of CSF rhinorrhea, where we see a central dark red spot and a surrounding clear ring area. Now, very important to know here is that this test over here, the halo sign, it is indicative of CSF, but it is not a definitive test for CSF. If you had to confirm that it is indeed CSF that is coming, the gold standard test that you would have to do here is a beta 2 transferrin test. That will definitely confirm that it is a case of CSF leak. And a very common complication in cases of CSF rhinorrhea, if it goes untreated, is it can develop meningitis. So that's about the halo sign that we see here. Now, there's another halo sign in ENT that you may know about, and that is a radiological sign that we see in cases of cochlear otosclerosis. So do not confuse both of them over here. Now that's about the halo sign. The second sign that we see is known as the teapot sign. Now what is the teapot sign? This is a clinical sign which is elicited bedside itself by just a posture change. So what happens here is the patient is asked to sit upright and then bend forward so that their head is down. What you'll see is a sudden gush of sudden increase in a clear watery nasal discharge will happen. So it will almost be like this increase in CSF nasal leakage when the patient bends forward, resembling how a fluid pours out of a teapot. And that's why it is called as a teapot sign. And this, why does this happen? So the sphenoid sinus ostium, it lies anterosuperior to the sinus floor. When the patient is bending forward, the CSF, which is pulled up in the sphenoid sinus, gains an easy access to the ostium. And therefore, suddenly the discharge increases a lot. And this is what teapot sign looks like. So these are the two different signs that we see in a case of CSF rhinorrhea, and these can be indicative of the diagnosis. One last short MCQ question before we end the class is, can you tell me what is the radiological investigation of choice to localize the leak, the CSF leak, the site of the leak? That would be to do a CT cysternography. So that's all about the two signs that we have for today. If you have any doubts regarding this, please note them down in the comment section and I'll get back to you. Thank you.